Some important updates from our advocacy as well. First, thank you all who let us know your concerns about the system. And as some of you know, I think the chair of our community management and myself have regular meetings with the deputy secretary of the Mental Health and Wellbeing Division. That's Catherine Wetton, and we also have regular meetings with the Minister for Mental Health, who is Gabrielle Williams. So we do have the opportunity there to take your issues to the highest level, where we discuss these and where we push back quite hard around why these things are happening and what it means for consumers' lives when these type of things are happening that we know that you're not happy with. So speaking to those, I mean, first of all, I wanted to talk about leave in inpatient settings. We know how important leave is for people, so they can have a break from that really restrictive environment that is an inpatient unit, and also so you can get used to being out of the inpatient unit as you're sort of making that transition to being away from there completely. So we're a bit concerned that in some cases COVID restrictions have been or very recently been used as justification for people not to have leave. So we're working really hard on that and wanting to make sure that we can find out as much as we can about that to try and improve that for people. If you've got any information about that, please do get in touch with us. The other one, of course, is that there is a Mental Health and Wellbeing Act that is coming into place on September 1st of this year. So there's a whole bunch of things that are enabled by that act, but the one I particularly wanted to talk about today was opt-out advocacy if you're being treated against your will. So currently, if you're being treated against your will, you can request an advocate and you will get an advocate from IMA, Independent Mental Health Advocacy. What changes in the legislation on September 1st is that it's no longer an opt-in where you ask for an advocate. It's now an opt-out where so you will automatically get an IMA advocate and you can opt out of that. So that's why it's called the opt-out. You don't have to have an advocate against your will, but you will automatically get one. And so we're looking forward to that happening as an important part of what happens in that act, which commences on September the 1st.